Equal Vision is a leading youth policy and research organisation. Our project, addressing the root causes of poor mental health, is an example of our work which aims to give young people a voice. Our ARC project is not focused on the way mental health care is delivered. We do know this is important. At Equal Vision, we want to work with like-minded people and organisations locally to find the best ways to help young people, to improve disadvantageous conditions such as poor housing, to prevent the likelihood of mental health care being needed. This is addressing the root causes. Effective prevention requires political will and action to understand the core determinants of poor mental health. Mental health services can provide effective support, yet people are often sent back to the conditions which contributed to the poor mental health issues in the first place. ARC is focused in the Liverpool 8 area. Using the small area mental health index, known as SAMHI, it is possible to see the alarming rate of mental health need in L8.
Crime is a complex issue that affects communities in various ways, from petty theft to serious offence like assault and fraud. It encompasses a wide range of acts violating laws and harming individuals and society. When looking at the incidence of crime, violent crime and sexual offences occurred 73 times per every 1,000 people in Toxteth, compared with only 48 times nationally. Similarly, the experience of crime linked to the possession of weapons was higher in Toxteth than Liverpool and England.
We were concerned about the quality and standard of housing in our local area. We looked at data to understand how this compared with other areas. It is obvious there are lower levels of house ownership and greater dependence on social housing locally. We also looked at educational inequalities from the 2021 census. What we found is that there are 1,490 people in Toxteth with no qualifications, which is 26.34%. This is higher than the percentage for England and Liverpool. In this regard, using this indicator, people in our local area are not supported to fulfil their potential.
We looked at two indicators to understand some general health outcomes for Toxteth. We looked at childhood obesity for people in Year 6 education. The results are worrying.
We also looked at emergency hospital admissions for children aged under 5. A&E admissions for Toxteth and Liverpool were comparable, with approximately 1,300 attendances for every 1,000 children. This is far higher than the rate in England of 630 for every 1,000. On average, around 25% of emergency hospital admissions are for respiratory infections, which can be seen as a consequence of conditions linked to damp housing and smoking in the home.